Hi guys, welcome to the channel. So this is day two of my coronavirus update and what's happening here in North Carolina. I am a bit relieved to say that nothing major has happened. I have decided to not pay attention to the media numbers because it's understandable at this point that the more testing kits are available to hospitals and medical facilities, the more the number of positive patients is going to go up. So, but as far as schools and colleges are concerned, some colleges are still open. I was supposed to take a class tomorrow at Wake Tech motorbike class, which was still on the last I contacted them, but I decided not to do it and do it at some point in the future when things are a little bit more clear as to what is happening. Immanuel school is still on, though I think there is a discussion among parents to request the school board or the state board to basically make it a decision for the parents to send their kids, and if the parents choose not to send their kids to school, that they be marked as excused and not absent. That it doesn't count against their attendance. Schools like Duke and UNC, they, as far as I know, they've gone to primarily just having online classes. I think spring break is extended for some of them just so that students, when they come back from spring break and start doing online classes, it gives them a period of adjustment. Marina is going to start working from home, the last I heard from her. But I wanted to touch base on two very important things because, again, I'm glad that there's not much to report on my end. I wanted to give a huge shout out to the doctors and any medical personnel because, this is the front line that they are at where they're being exposed to this virus. We can stay at home, we can work from home, our kids can stay at home, but doctors and medical professionals, they are being exposed to this virus and all the sicknesses, and they're doing the best to provide all the help they can with the limited resources, because as of right now there still is not any vaccine for this or any medication, so they're trying to do the best with what they have. So a big shout out to any doctor and any medical personnel dealing with and providing help on this situation right now. The second thing, I got an email today from my personal doctor. They had some recommendations on what to do and what not to do. And one thing really struck to me because I didn't think about it, but they actually suggested that if you have the symptoms of this coronavirus, do not go to your local physician or your primary care provider or walk into an urgent care. Um, it's best to call your local physician or call a hospital, let them know that you have the symptoms, and most importantly, make sure that they have the testing kit, because you might be feeling crappy, you might be feeling bad, and you could make that journey to the local hospital or the local emergency room only to find out that they do not have the resources to provide you the best support or the best assistance that you might need at that moment. And so they might recommend you going somewhere else, and then you're going somewhere else. But most importantly, when you go into that urgent care, when you go into that doctor's office, you could be exposing the patients over there. And one thing that we know that this coronavirus does is it causes more damage to people who have a low immunity. And obviously, people who are in doctors' hospitals are already sick or have some other pre existing condition for which they are at the doctor's hospital, and being exposed to this coronavirus might actually make it worse for them. So, God forbid, but if you do see yourself having any of the symptoms, just call your local physician, call your doctor, or call the local hospital. Let them know that you are showing the symptoms. Ask them if they have the kit, and if they do have the kit, let them know that you're on the way so that they can take care of you, and direct you where you need to go so that other people are not exposed. Still, avoid large crowds, wash your hands, simple things you should do every day, but also stock up. It's not a pandemic, it's not something that we need to go crazy about. This is not the zombie apocalypse or some really bad thing happening. Yes, it is bad, but it's not one of those situations that we see on television so much that we need to stock up. It's not doomsday yet, but people are panicking and they are actually going to the stores and buying stuff in bulk, which makes people who just want to go buy simple things, when they go they see that those things are not there in the store anymore. So just stock up on the things that you need. Probably do like a 14-day grocery. Peanut butter, jelly is probably, and bread, and non-perishable items would be awesome, because the last thing you need is you wait till the last moment, you go to the store, and then you find that there's nothing there. So stock up as much as you can. I'm continuing to see any progress that the government is making. I saw President Trump address the nation yesterday, where he talked about having the wages non-taxable. So basically, no taxes will be taken out of our wages. I guess till the end of the year, because the economy also is taking a hit. Also, since the economy is taking a hit and stock markets are falling and stocks are probably at a record low, if you have money saved up, try and invest in stocks, because this coronavirus is going to pass away and stocks are going to become stronger and stronger and they're going to rise. So if you ever thought about investing in stock market, now would be the time. I bought a couple of stocks in Pinterest, but again, do your research on the company. And if you do have some savings and you're looking to add some more to it, a stock market right now would be a good idea, in my opinion. But stay safe, guys. Stay healthy. We'll make a video tomorrow again. Hopefully, just like today, nothing major to report. I'll give you an update on the schools over here. But as of right now, all elementary and middle schools, and I think some of the high schools are still open. I think they might close the high schools first, because it's not affecting kids as much as it is doing adults. And usually schools are deciding to close if and only a parent or a child is showing the symptoms. So there have been a couple of schools in Raleigh, but nothing here in the Morrisville Cary area. But I'll keep you updated, guys. Thank you for watching the video. Stay safe and stay healthy.